Hey everyone. So today I wanted to talk to you more about fascia and myofascia. I've been learning so much about fascia. I've always known about myofascial tissue, how it really pulls the whole body together. But when thinking therapeutically about yoga, we must consider the nitty gritty physiology and anatomy that makes us who we are. So I've been exploring other forms of movement theories and philosophies for a very long time. I've long been interested in martial arts, Tai Chi, Qigong, and of course, I've been studying yoga and Pilates and its therapeutic use in my field as a physical therapist. But the concept of somatic movement has interested me for years and it's becoming so clear to me today. So there's Alexander method, Feldenkrais, and other forms of movement therapies for the body workers emerged about the not emerged, but pulled together the concepts of body mind and its applications to be sure that the big picture is considered to take a stance on the alkaline methods. So this whole concept of somatosensory integration, how movement should be an integrated approach, not a specific body part by body part type of an approach, is sort of what I'm talking about. And these other forms of movement therapies for body workers is something that I've explored, and it was just fascinating to me as I consider taking a stance and creating our own framework to understand the body and also apply it in a systematic way through the alkaline method. So today, I want to introduce fascia or myofascia that connects our whole body. It's an important concept because it's what keeps us whole and working as a whole system versus parts and pieces. It's also the system that is responsible for the mystery of the workings of our body because it has not been fully embraced in the Western medicine world. In physical therapy school, okay, we get to dissect cadavers, which then are left for the medical students and dental students to study their respective body parts, right? So it was an amazing, intensive 6 week of dissecting cadavers and really understanding the parts and pieces of the body. So when we dissect the body, we tear the skin apart and we're able to dissect each pieces of the, uh, the muscle pieces with its attachment and insertion sites. And for 3 years in my doctoral degree in physical therapy, I've been fortunate enough to be selected as a teacher's assistant to study further during the summer months. So I have a lot of understanding of a human anatomy. It's something that's always fascinated me. And I've seen the fascial tissues encasing each muscle. But it was appreciated as something to recognize, but was cut away for the important muscles, nerves, and arteries, etc. All this to say, it's completely ignored. And when eating chicken, right? You guys all eat chicken. Hopefully, you're not vegans. But when you're eating chicken with the skin on, it's what keeps the skin on the meat. Have you guys pulled away the chicken meat or the skin away from the meat, and you see this web-like encasing, that you see, right? It's just a fibrous tissue. And it's not uncommon as a physical therapist to get complaints from the patient about referred pain away from the site of injury. It's called the trigger point in our body, and it's in large part related to this fascial structure that connects our body in pieces. So you might have an injury somewhere, but you might have referred pain elsewhere. I get this so much from my patients. It's also important to note that as women's health physical therapist working with pelvic floor dysfunction, I've had many patients who had tendency to develop tender or scar tissue and adhesions. It's what endometriosis is, right? Around the reproductive organs, which are knotted fascia, so much so that it would warrant surgeries only to make the matters worse. Here's something you have to remember: a systemic inflammation will tighten our myofascial tissue, and it's very sensitive to the nutrients that it receives from what we eat every day, right? So the fascial system involves the whole body. It can't be isolated into parts. When injured, it involves the whole body dynamics, which ultimately affects our movement, which ultimately affects our yoga practice. Plus, with respect to creating length and flexibility into our body, it's the fascial system that needs to be stretched out, involving the somatosensory techniques that are more gentle, slow, and involve breath to make permanent changes in flexibility. That's something all yogis are interested in. So, the more you can understand how to manipulate your fascial tissue through your movement by moving slowly, intentionally, and with breath by feeling, is going to be key in you enhancing your ability to practice yoga safely. So, before I overwhelm you any further, let's learn about what it is and why you should care in your teachings and in your yoga practice. So, what is myofascial tissue? Well, fascia specifically is defined by Tom Myers, the author of Anatomy Trains. Highly recommend this book, is a biological fabric. It's the connective tissue network that holds us together. Fascia is all about the collagenous used soft tissues in the body, including the cells that create and maintain the network of extracellular matrix. Okay. So it includes all the tissues, including tendons, ligaments, bursa, and all the tissue in and around the muscles, the endomysium, perimysium, and epimysium, because they are all made out of the same composition. Also included are the fascia around our organs. There are bags that hold the organs in peritoneum and mesentery in our abdominal cavity, pleura, and membranes that surround our brain, spinal cord, and peripheral nerves as well. And we as humans are approximately 70 trillion cells, which include the neurons, muscle cells, and epithelia, all holding together in relative harmony. Fascia, then, is the 3D spider web of fibrous, gluey, and wet proteins within our body that holds all our tissues and organs in proper places in our bodies. Understanding fascia is critical to movement, high performance, and recovery from injury and disability. It's also important to note that the fascia enables our muscles to contract and lengthen depending on the demand, and it allows for smooth gliding when restricted, or it allows for smooth gliding, and that's what you want, right? When restricted, it becomes sticky, and when the muscles can't contract and lengthen, it causes so much pain. It's got 6 times more receptor sites than muscles, which means that the tightness that you feel when stretching into a downward dog or a forward fold is not the muscles so much as it is the fascia responding to the stretch. So when it pulls back, then the receptors provide you with a hard stop, and that's usually in the way of pain. So it's important to ease into the stretch using somatosensory system versus forcing your way into a stretch, which I see happen so often. It's also sensitive to our diets, like I mentioned. When our diets are inflammatory with lots of sugar, for example, it becomes sticky and we tend to be tighter and stiff. So I want you guys to like really recognize that. So, when thinking about the whole body, we tend to also create poor muscle memory and motor habits that can perpetuate its dysfunction to have a detrimental effect, especially in our yoga practice. And as my physical therapist colleagues will tell you, we will never run out of business specializing in yoga injury because there's a ton of people getting injured in yoga. Remember, this is supposed to be a healing practice, so it bears repeating that we must pay attention to the following principles of the alkaline method yoga. Okay, first, you need to learn to anchor your body and properly align all your joints and respective bony pieces together. Really learn to activate your core and understand there's always a polarity force, right? Pelvis, apana going down, rooting down. And then there's a surge of up leveling force to provide this polarity to create this length. And then you always want to find your breath as the gauge for movement, and then create balance in your body. And sometimes we need counterbalance to properly level out our body symmetry. So we need symmetrical movements in our bodies, but in order to achieve this, we need to first become aware of how our bodies are moving. I can tell you from 20 years as a clinician treating physical therapy patients that even the most coordinated people lack body awareness. There's a full spectrum of individuals who have no sense of spatial orientation of our bodies or of their bodies. They're the ones that are clumsy, two left feet, etc. Like I was born that way, I think. I would never be able to do a waitressing job because I'll be making a mess. I'll be a hot mess. And then there are those who are so well trained doing triathlons, running, etc., who have repetitive injury or have significant imbalances in their bodies because they don't mindfully balance their bodies by training to counterbalance their dominant motions. This is especially true for sports such as tennis, golf, baseball, football, etc., where it requires rotational movements into their dominant side. So, how do you move away from injury and be a yoga practitioner who helps people heal? Because more and more people are flocking to yoga classes to feel better. We need better educated, responsible yoga teachers to take time to train deeper. Too many yoga teachers focus on esoteric practices of yoga, which is more yang. Like it's beautiful to chant and talk about forget the movement, just feel into it, they say. And I love that at times, but there are times and places for to learn the yin aspects of really understanding your human anatomy, physiology, and the nitty gritty sciences that ultimately help their students to heal inside and out. We need both. I've seen lots of chanting, meditations, and healing trauma types of yogis who can attract your students, but it's important to ready the body for the mind to take a seat. Really think about that. In order for your mind to take a seat in your body needs to be comfortable. Yogis understood this, which means that we must teach our students to be pain free first and foremost, and optimally moving with efficiency so that they can sit into the yang practices of expanding their mind, egoless into their spiritual healing journey. It works both ways. We need both, right? The alkaline method is all about the balance of science and philosophy, giving yin to the yang and providing quality practices that is based on principles rather than tactics for long-term longevity and health versus short-term or superficial practices that can potentially hurt rather than heal. Because when we're physically injured, we're compromised and our mind has a harder time to take a seat in our body for mind body mastery, which is ultimately the practice of yoga. So, I really do hope this was helpful for you today. If you enjoyed this podcast, please subscribe, and I would personally appreciate it if you can leave us a review on iTunes. Okay, it's Alkaline Yoga, and it's Refine Your Yoga Practice is the name of the podcast. It truly helps to reach more people to listen to this message and create a safer practice that heals. And I just want to invite you guys, if you're finding this for the first time, I'm hosting a pretty much a full week intensive learning all about anatomy and alignment workshop in our private alkaline yoga community Facebook group. So if you haven't explored your options, please go ahead in there. We have amazing alkaline yoga teachers there showing up for you every single day. Next week is our big week where we're going to be hosting this live launch where we're going to be talking to you and educating you every single day. I'll be showing up every single day at 12 o'clock, and we'll be hosting watch parties. And after, if you sign up afterwards, we can provide you with all the recorded things on a web page where you can go and listen to them. I believe this is super important, and this is the work I'm meant to do to provide a safe healing practice for all yoga practitioner and yogis alike. Be different, level up, you guys. Let's elevate so we can be healing. And really, most importantly, this is alkaline method is all about creating an internal healthcare system within so we can be more in tune with our health and our bodies in ways to really enhance everything that we do. So health is wealth, you guys, and I hope to see you guys all next week. Thank you so much for tuning in, and bye-bye.